Good morning and welcome back to GP Video Podcast by Nadia. Today is Christmas Eve, so wishing you all a very happy Christmas, and we continue with the topic of metabolic syndrome that we have started a few days ago. So today we are talking about the treatment of metabolic syndrome. So as you know, metabolic syndrome is a cluster of risk factors or conditions that increase the probability of a patient getting brain stroke, heart attacks, and type 2 diabetes mellitus. And what are those four risk factors? Those four risk factors is a single parent, number one being obesity, especially the waist circumference being high, and the three offsprings or three siblings, high cholesterol, high BP, and high sugars or insulin resistance. So what is the treatment? So we spoke about the lifestyle intervention and diet and all yesterday, which is of course the first line. But then most of the times people are not able to achieve those goals with all of that. So what is the medication? Unfortunately, there is no medication yet licensed for the term metabolic syndrome, because it's a syndrome cluster of risk factors, cluster of symptoms, cluster of conditions. So there is not one drug that will treat all of these four conditions, but one medication that is being considered is called metformin. Metformin is an anti-diabetic drug basically that lowers your blood sugar levels, but is also very multifaceted, and I will talk to you about metformin in detail in another video podcast. But metformin is trialed by GPs. I also trial it with the patients who are insulin resistant, who are obese. Usually such patients, if they are females, they have polycystic ovaries as well. So metformin is good for this condition, but it's not licensed. But apart from metformin, if we look at these four different conditions, so as I said, parent is the obesity. So addressing obesity is very important, because once the weight is lost, it actually will improve your sugar levels, your insulin resistance, your cholesterol levels, and your blood pressure as well. So if out of all these things we really want to treat one, or we want to start from somewhere, we should start from losing weight. And for losing weight, again, as I've said, that there are many options available these days. There are a couple of medications for lowering appetite, for appetite suppression, which is called phentermine and Contrave. You can contact your doctor for that, and they can, after seeing all the indications and contraindications, they can put you on that. Or the better option is the injections. Like Wegovy or Mounjaro or Saxenda. All these injections are very useful, because they have got a very safe profile. Apart from some gastrointestinal side effects, they don't have any long-term side effects. They are good for heart, they are good for other organs of the body as well, and you can be on it for long term. So these injections are GLP-1 agonists. These are very good and can be easily adopted, can be easily done, and should be done if you are fighting with obesity. The other option is surgeries. One that I have done, gastric sleeve, very highly recommended from my side. And the other one is a bit complicated one, and it's for highly morbid obese people, which is the bypass, but only if you qualify for it. If you qualify for it and if you really need it, you should go for it. That also doesn't have like obesity, the side effects are not that so there is a risk versus benefits. So if benefits are more, some of the risks can be ignored. So but gastric sleeve, that is a very safe procedure if you want to go for it, if you are dealing with obesity for a long time and even the medications have not been able to help you, so you should go for it. So obesity is number one to be treated either with lifestyle interventions and diet, along with medications. There are oral suppressants, appetite suppressants. There are these GLP-1 agonists that are very useful for obesity. Or if these things are not helping you, then you should go for the surgery. Then we come on to the cholesterol and blood pressure. If your cholesterol is in the therapeutic levels to be treated, then please go on statins. Statins will help you with lowering cholesterol. And if your BP is in the treatable range, please go on blood pressure medications, so that till you are losing your weight, till you are lowering your cholesterol, your blood pressure should be under control. Otherwise, high blood pressure can give you stroke, can give you heart attack. So cholesterol should be treated with medicines if needed. High blood pressure should be treated with medications. Obesity is number one, because once you lose weight, you can even go off your cholesterol medications and blood pressure medications as monitored by by your GP, until and unless it's not a genetic problem. But yeah, and gastric surgeries. And then metformin is also good for insulin resistance or high sugar levels. They are very good to be put on, until and unless you don't have any contraindications and you're not observing any serious side effects. So this was all about metabolic syndrome. We'll come back to it if needed, but Merry Christmas to you all, and see you very soon.